Frederick. We're located on Market and 7th Street down there. We just opened our, actually got our brick and mortar business. I started out as a very virtual and mobile company, so I'm really excited to now have my actual location. So I originated as a physical therapist assistant, and my background was really working with older adults with neurodegenerative diseases. So I've been working with them for years and years and years, and that's really where like my passion lied, along with trying to educate people about how they can improve their lives health-wise, right? So I really kind of discovered that I loved teaching, I loved educating, and I loved brains. So during the pandemic, it just kind of seemed like a really good idea to combine all of that. So I'm a dementia care specialist. I'm a licensed physical therapist assistant and licensed memory coach. Older adults are definitely my passion, but I work with people of all ages. I'm on the board for SOAR and ESPC, two really amazing groups in Frederick County, really, that really work toward helping older adults, improving their lives. If you don't know what SOAR is, I highly recommend checking it out because most people don't know about them, and they are a free resource in Frederick County for underserved older adult populations, people that don't have a lot of money and need some assistance with anything that they need. SOAR is going to help them. So I just wanted to plug SOAR for a minute because nobody knows they exist. So, my goal is to help as many people as possible improve as many aspects of their brain as possible. So I founded the Maryland Center for Brain Health in 2021 as a way to help people identify the root causes of cognitive decline, or if they're looking for prevention, let's say they have a family history of dementia, Parkinson's, things like that, they can identify their current risk factors and implement interventions that they can start, doing in their life right now to ensure that they don't get cognitive decline in the future. So today I wanted to talk about hormones because they are a very vital piece of our health puzzle. And so I want to chat with you all about what are hormones, what are the different types of hormones, and how they relate to brain health. I'm going to talk about the Women's Health Initiative study, which is that big study that was done in the 90s that kind of set the stage for everybody being anti-hormone replacement for decades. We talk about knowing your hormone levels and how to advocate for yourself at your doctor's office. We're going to talk about the pros and cons of hormone replacement therapy and why cognitive assessments are vital pieces of information to help you know where to start if you even want to begin going down that route. So my goal with this presentation is to help you just be a little bit more informed about some information in regards to brain health and hormones. I could do probably like 4 or 5 presentations on just this topic alone. So this is going to be just a bit of an overview. My goal is to give you the tools to be able to find some more information yourself. If you look on the second page of that, there's a whole list of resources. These are articles and things that I used to compile this presentation, but also places for you to go if you want more information about any of these topics. This is just a small list. There's so much information out there, but I just kind of want to arm you guys with some knowledge and empower you and help you be able to advocate for yourself and be able to weigh the risks and benefits. So dementia has definitely become a global epidemic. I think that most of us know that Alzheimer's especially is really becoming a huge epidemic, not just in the US but in the world. And dementia rates are expected to skyrocket by, I think 2030, there's supposed to be about 78 million people with dementia, and that's really not that far away. Like, I hear 2030, and I'm thinking, we got like 20 years in the future. No, it's like 8 years from now. Wow. So it's really coming up. And so it's really crucial to learn what your risk factors are for cognitive decline, and hormones play a role in that. So if you're over 40, oftentimes the groundwork for Alzheimer's disease can already be at play in your brain. Research shows that Alzheimer's starts forming in your brain sometimes 20 to 30 years before symptoms even show up. So I get a lot of people asking me, I don't have any problems, why should I care? Why do I care about cognitive decline prevention? Like, why should I even be thinking about this? And it's because, just like cancer, things start working in your body early, and then we don't notice them until they're finally a huge issue. And my goal is to help it not become an issue like that, right? So there is definitely also a significant discrepancy in Alzheimer's disease between men and women, and we're going to talk about that in a little bit as well. So brain health is a very multifactorial issue. There's not just one thing that goes into cognitive decline or keeping our brains healthy. A lot of people think, oh, I do Sudoku and I'm good, like I'm great, that's all I need to do, and I'm gonna be my brain's gonna be sharp till I'm 80. It's really not that simple. It's why there really isn't a drug or a pill to cure Alzheimer's yet, because again, they're just looking at one little thing when there's like 30 other things they need to be looking at. So there's never gonna be this magic pill, I don't think, in our lifetime that is ever gonna like cure anything like this, because it's not just one issue. Hormones are a small but really important piece of our brain health puzzle. So what are hormones? Hormones are chemical messengers, basically. So they talk to the rest of our body, and the rest of our body talks to our brain. So let's say you get hungry, and you start to feel those hunger signals. That is a hormone signal going from your stomach up to your brain saying, feed me, I'm really hungry, let's do something about this. So there's a lot of different hormones. These are just some that I think people are most familiar with, right? Thyroid hormones, estrogen, progesterone, testosterone, DHEA, cortisol, melatonin is a hormone. If you've ever taken melatonin supplements at night, that is using a pill to kind of help regulate this hormone that is supposed to happen naturally in your body. So neurohormones are so incredibly important for the brain. Right, hormones actually start to have an influence on our brain even before we're born. So in utero, hormones are working to develop our brain. That's how incredibly crucial hormones are for our brain. And the human body produces a variety of hormones, and they have a very direct influence on our brain health and our mental health as well. So hormones deliver a lot of information to our cells. When cells can't really function properly if they're not getting the information that they need, and if there is not a proper balance of our hormones. So it's not enough just to have hormones. Our hormones really need to be in balance so that they can be talking to each other and talking to the different parts of our body like they should. A good way to think about this, like hormones in your body, is like baking a cake, right? So if we're baking a cake, we've got all the ingredients and we accidentally leave out flour, right? That's a crucial ingredient. We're gonna end up with soup, like chocolate soup, which doesn't sound terrible, but it's probably not what we were intending for. Hormones are the same way. So we've got this brain, we've got this body, but we're missing a crucial ingredient as we get older. And you can't just leave out the hormones and expect to have a functional body and brain. A good amount of our hormones are actually produced in our brain. And I think a lot of people just think about hormones in terms of reproduction, but a huge chunk of them are produced in our brain, which is why people that have had concussions or traumatic brain injuries, looking at their hormones is so incredibly important, because when you've had a concussion, you get a blow to the front of the head here, right? Look at where your pituitary gland is, right? That is your pituitary gland can get damaged. And what that does is, if it gets damaged, it messes up all your hormone signaling. So all of a sudden you're not producing your thyroid hormone or your progesterone like you need to be to help control the rest of your body. So it can cause a lot of issues, especially when this happens in children. Children that play contact sports get a lot of concussions. They grow up into their teens and 20s and they start having serious mental health issues, depression, anxiety. And they just think, oh, why is this happening? I don't understand it. It's not happening for no reason. It's usually because their hormones are messed up and they're not being produced like they need to, because they had so many concussions from all these contact sports, that they're playing. So it's a whole nother soapbox. So your pituitary gland is incredibly important. It's a huge part of your endocrine system and in creating the hormones. And it tells and other parts of your endocrine system when to release hormones as well. So it's very, very vital, little tiny gland that's up there, but it does so much. So hormones are definitely a two-way street, right? They're not just coming out of our brain and going to other parts of our body. They're being produced in other parts of our body and going to our brain. So it is a constant cycle, and it's really important that we have those messages that are going both ways to be able to influence the activity. So we're getting hormones produced in our reproductive system, we're getting hormones produced in our brain, and it's important that they're all talking to each other at all times. So there's a lot of different types of hormones in the body. For the sake of brevity and time, I'm really only going to discuss 3 of them today. I could talk about a lot of them, but today I really want to chat about estrogen, progesterone, and testosterone. These are the 3 main hormones that when somebody gets on our protocol that we usually end up supplementing for, because they're usually the 3 that are the lowest in people. Unless somebody's had a really, really significant traumatic brain injury or concussion, then we're going to look at some deeper hormones like growth hormone and stuff like that. But these are the 3 main ones that people usually end up having issues with. Hormone discussion is almost always very controversial, and it's usually due to that study that I referenced earlier. There is so much more information out there about hormones nowadays than there was back in the 90s. And I don't want to make any sort of like blanket statements about hormones, or because everybody is very unique. Each person is unique, and their health history, what's going on in their lives, everything is very personal to you, right? So I don't ever like to make blanket statements of everybody. It's not like Oprah, right? You get hormone replacement, you get hormone replacement. We're not trying to do that. So I just want to give information, and then it's, so that you have the information and the tools. But it's definitely important to know your health history, and when you're talking into anything about like hormone replacements. So question, do you guys think men or women have a higher rate of Alzheimer's disease?
For some reason, I think it's women.
Yeah, it is. Yeah. Do you know why that is?
Gotta be hormone.
Estrogen.
Probably a big part of it. How high do you think the discrepancy is? What do you think it is, like percentage wise? 60% women?
I'm guessing.
Yeah, you're right. It's 75. Yeah. So women get Alzheimer's almost 3 times more than men do. It's a huge, huge discrepancy, and there's a lot of things that go into it, but a big one is the fact that we lose our nourishing supportive hormones as we get older, and they are so crucial to the brain. Men and women have the same hormones. We just have different amounts of them. And I think sometimes people and doctors especially forget that, that we all have the same hormones. It's just different amounts of them. But we just sort of have this built-in timeline where we start to lose a huge amount of the portion of our hormones. So hormones are so much more than reproduction, and I think in our society, and especially in the medical field, we get really stuck on only talking about hormones in relation to reproduction. Yes, they're absolutely vital and essential for that, but they do so much more in our body, and they do so much more in our brain, and nobody ever really talks about what hormones do to our brain or why they're important in our brain. They're very, very essential for brain health. One of the most crucial hormones for brain health is estrogen. And there's 3 main types of estrogen. You have estrone, estradiol, and estriol. And they all sound very similar. Like you guys kind of broken this up a little bit, right? So 3 main types of estrogen. And estrogen is so important for brain health. It's important in memory, like really, really crucial to memory. If you've gone through menopause, or you kind of felt what that feels like when you start to lose that estrogen and you start to get the brain fog and the memory lapses, that's partly due to estrogen. It's also protective against neurodegenerative diseases and cognitive decline. And I really think that talking about hormones only in relation to reproduction really, in menopause, it doesn't really do us a service about like even understanding what menopause does to the body, right? Because we only ever talk about it in terms to reproduction, and it's not just about loss of fertility. The loss of these really critical ovarian hormones, estrogen and progesterone, really changes the metabolism of our body, which is our metabolism is our energy, right? It's our energy producer. So that's why a lot of times when you're going through menopause, you feel fatigued, like you're exhausted, and you're not sleeping well. It's because our energy production is not doing what it needs to be doing. So after menopause, the ovaries actually stop producing one of the main estrogens called estradiol, and then the body goes into a state of estradiol deficiency. And so I want to talk a little bit about estradiol and how important it is. So estradiol does a lot in the body. You can see it up here. It's got huge ramifications on the brain and the body. But what it does in the brain is it helps with our neuronal synapses. So, right, the neurons in our brain, the synapses that are happening, it helps with neuronal health. It helps with the immune system of the brain. I think a lot of people don't realize that our brain has its own immune system. So the estradiol really helps keep that immune system good and going. It really helps with autophagy. So autophagy is crucial for brain health because what it is, it's kind of like the recycling plant in our brain. So brain cells die, or they, come apart, or they just start to get, bad. Autophagy is when those brain cells get gobbled up and they get recycled and either made into waste or made into new things. If autophagy doesn't happen, things start to build up in our brain, and it has a really significantly detrimental effect. One of the biggest things that makes autophagy happen is fasting. And so when are we fasting the most? Usually when we're sleeping, right? That's the easiest time to fast. We don't eat when we're sleeping. So when your sleep cycle starts to get disrupted and you're awake, and then maybe you're eating because you're awake or you're snacking, that is interrupting that fasting cycle, so that autophagy is not happening as much. And so we're not getting that clearing out, which in turn can start to lead to the misfolding of proteins and the amyloid beta plaque buildup. So it's just kind of this like unfortunate compounding that happens in our brain when we're not getting adequate sleep or adequate hormones that we need. It modulates our mitochondria. Do you guys remember like 6th grade science class when you had to like color the diagram of the cell, and like the mitochondria was the powerhouse of the cell? So our mitochondria are so vital to our just daily functioning. And estradiol is really important in helping those mitochondria be healthy and recreate new mitochondria. It's also really important for the vascular supply. So our heart, right, our cardiovascular supply. And, vascular dementia is, a really difficult dementia, to deal with. And so if somebody's having vascular issues or cardiovascular issues, estradiol is really, really crucial for keeping your vascular system really, really healthy. So estradiol also impacts how we learn, right? And our memory. It's, really vital in our hippocampus, which is our main memory generating center of our brain, right here, there in the back of our head. So the interesting thing about memories is when we're being formed in the womb, our brain develops from the back to the front. And as we go through life, we develop our memories from the back to the front. So that's why when people get Alzheimer's and dementia, when they start to lose their memories, the last memories to go were the ones that were formed first, because that's kind of how our brain develops with that. So just kind of interesting tidbit about like how our memories are formed. So there's a lot of studies that show that exposure to estrogen throughout our life, so we start getting exposed to it in puberty when we're really young, really improves cognitive status with age. So there's definitely a lot of studies out and starting to be studied about like birth control and what's happening when we get on birth control and we start lowering certain types of our hormones and increasing other types at a really young age. What is that doing to us, and how is that going to start affecting our cognition as we get older, when our hormones aren't kind of allowed to do what they're supposed to really be doing?
Yes.
So let's talk about estrogen in men, because I think when we talk about hormones, we really people really focus on the female aspect of it, and if you talk about men, the only thing that they talk about is testosterone, right? But men have our hormones too, and they can get out of whack in men just like they can in women. I'm only going to briefly touch on men, just because I really think it's important to know, just if you have sons and husbands and loved ones in your family, if something starts to get weird, this is an area that you can explore as well. But estrogen plays a huge role in the development of the male brain, and it's thought to be protective later in life. So men, as they get older, tend to have more estrogen in their brain than women do. Right? Unfair. And this is important because the brain converts circulating testosterone into estradiol in the brain. So men naturally have higher levels of testosterone than women. So this allows them to create the estradiol as they get older, whereas women, we lose our testosterone, we lose our estrogen, we lose it all. But men are still able to keep this production going, so it helps keep their brains a little bit healthy a little bit longer. There was a study that they did that found that giving men estrogen later in life improved memory for both men and women. And most doctors don't understand the role of non-androgen hormones in men. I found this to be true through the protocol that I use and just from the doctors that I talked to. I had a gentleman come to me who, he was a veteran, and this poor guy had been through the ringer. I think he was in Afghanistan like 3 different times. He had been blown up numerous times. He had more concussions than who knows what to do with, right? He has had 2 different types of cancer. This poor guy, he had lived in Frederick all his life, and he told me that he now needs a map to get around town because he can't even remember how to get down the street anymore. Not getting the help that he needed. He's been in the VA for years, not getting any help, like not getting any better, not getting what he needed. So his mom actually came to one of my talks at the library, told him about me, so he came and was super interested in what I was doing. I was talking to him about, there's a lot of research about concussions and hormones and things like that, and just supplementing and finding out what you're low in your body and then boosting it up. So I gave him, information. I gave him the labs that we like to get done, and he, took him over to his doctor. His doctor took one look at the labs and was like, "What is this? Why do they want to test for this? Why do they want to test? These are female hormones. Why are they looking at female hormones?" I'm like, "They're not female hormones. They're hormones. They're just hormones." So he needs to say he is not getting the help he needs because his doctor talked him out of getting help. So, but that's what happens is doctors don't necessarily understand, like, why are you looking at that? Why do you want to look at that? Well, because his hormones were probably completely shot, and he was probably not getting anything to his brain that he needed. So it's very unfortunate, but that's part of like why I do this and why I like to talk to people and why I like to educate people, because there's so much information out there, and if doctors would just look at the research and what's out there, we could help so many more people. But that's that story. So progesterone is really vital for connections in our brain and neural components in our brain. Most people only, again, talk about the reproductive aspect of progesterone, how it's released by the ovaries and it prepares the tissue lining of our uterus for pregnancy. But it's really important to talk about progesterone because a lot of women, for whatever reason, don't have a uterus, right? With hysterectomies, like things happen that we end up without a uterus. And after somebody gets a hysterectomy, they end up going into menopause, right? So what happens then is they go to talk to their doctor, like, "I'm feeling terrible. What's happening? What can I do?" And the doctor's like, "You don't need progesterone. You don't have a uterus anymore. There's no need for it," right? And that's so short-sighted, thinking that progesterone, the only need we could ever have for any of our hormones is to reproduce. So how does progesterone affect the brain? Many, many ways. This is one of the most powerful hormones on the brain. It really works on a lot of different receptors in the brain for not just cognition, but mood as well. It's being used as a treatment for traumatic brain injuries because of its regenerative properties in the brain. It's able to regenerate those loss of neurons and the brain cells in the nervous system. So it, again, supports the mitochondrial function just like estrogen does. It supports healthy blood flow, right? So again, that vascular system. It supports improvements in cognitive functioning, mood, and it helps us regulate our stress responses. It helps with anti-inflammatory activity. So inflammation is one of the biggest drivers for cognitive decline right now through the foods that we eat, our daily lifestyles. It's huge. That's why they call Alzheimer's diabetes type 3 because the inflammation in our body is a strong driver. But progesterone is very anti-inflammatory, so it has a really fantastic effect on the body, which can be very protective against these cognitive disorders. It helps to maintain the myelin sheath, which is the really protective sheath around our nerves that allow our nerves to get signals. Like in multiple sclerosis, you get that myelin sheath starts to break down, so your nerve impulses are no longer able to talk to each other. So this helps protect that, and it protects those tissues around the nerves. And it's made in your brain by your brain cells. So it's not produced, it's also produced in your brain and in your reproductive tract. So very important hormone, really phenomenal for brain health, really important for helping to keep our brain healthy. And testosterone, not just for men. Women need testosterone as well. So what does testosterone do? It helps support sexual desire, super important for bone density, right? Women go through menopause, what happens to us? Osteoporosis. So testosterone is really important for that. It affects both male and female brains, and low levels of it have been linked to Alzheimer's and degenerative diseases, largely primarily in men. And again, like I mentioned before, the brain converts that testosterone into estradiol. So low testosterone in women can actually lead to low estradiol, which in turn has that cumulative effect of leading to poor brain health. We never want to give testosterone therapy without giving estrogen therapy as well. Because if somebody is low in testosterone and they're low in estrogen and you just try to boost up their testosterone, it's going to have a negative impact, and it's not going to have the impact that you want. So if anybody is, trying to supplement with testosterone, you really want to make sure that the doctors are looking at the rest of their hormones as well, and making sure that they have sufficient estrogen supply in order to be able to make the testosterone worth anything. So Same thing with women. If you're, ever supplementing with anything, trying to boost up your testosterone, you want to, make sure that you're kind of doing it in tandem. Again, it's that hormonal balance that we really have to try and strike. So I always like to ask people, what's in your brain savings account? And what do I mean by this is that every system in our body to some degree gets affected by menopause when we go through menopause. And over time, that has a really huge impact on our brain health, in our cognition, and in our mood. And a lot of times, as women are entering menopause, they're entering in a very suboptimal state. So their bodies are not in peak condition. We're not, it's like I always tell people back in physical therapy, if you're going to go get a joint replacement, right, you want to make your muscles as strong as you possibly can. Because if you go into a joint replacement with incredibly weak muscles, your recovery is going to be unbelievably difficult and so long. But if you can go into it with if you're getting a knee replacement, really strengthening up those legs, trying to get in the best shape as you can, getting out of that hospital, your recovery is going to be 1,000 times easier. It's the same thing with our brain. Going into menopause, which already has this hugely detrimental effect on our body and our brain, if we can go into it at a more optimal state, the effect is going to be a little bit less. There's a lot of factors that affect our cognition as we age, right? Like our circadian rhythm changes, our sleep patterns change. We're affected by, blue light exposure, environmental toxins, endocrine disruptors, and like I said, hormonal contraceptives. So there's a lot of things that can really affect, how our body is functioning and how our hormones are functioning even before we go into menopause. So it's really important to, try and put ourselves into an optimal state even before we hit menopause, so that we don't have such a negative metabolic effect on our health. So it's like all of these factors kind of come into play, and it sort of creates this perfect storm within our body, and it really affects, our quality of life as we get older. So how can we know if we're in an optimal state, right? Like there's so many factors to look at. So I really like to talk to people about this because I think it is so important to know, like if you go to your doctor, right, and you get your yearly physical done and they draw blood, how many of you go through that blood work with a fine-tooth comb? I do too, right? So a lot of people don't, right? They go get their blood drawn, and if their doctor never calls them, they just assume everything's fine, right? Yes. So many people do that.
Sometimes ignorance is bliss.
But it is so important to know what's going on in your body. So whenever you get your blood work drawn at your doctor's office, you want to take that and you want to look at it and you want to look at your levels. And if there's a lab thing, like get Google, open up Google and be like, what is RBC? Or, like what is this, right? It's because the more you know about your body, right, the more power that you have. And this is important because if you look at the values here, right? So these are what doctors use, like when you get your labs done, right? Oh, this value was low, this value was high, this value was like really low. Doctors are looking in this section here, the quote unquote normal ranges. So how are these ranges figured out? Like they seem so arbitrary, and they're completely arbitrary, these ranges. So how they figure these out is that it's 95% of all random people tested had this range from the bottom number to the top number. So that's the range, right? And it's just 95% of people were from here to here, which is like, you look at the population, men, women, sizes, we're all so different. So how can you, it's like a one size fits all of these normal ranges, and that's not really how life actually is. So, and as the population gets more unhealthy, these ranges are going to be more skewed because people's numbers are going to continue to, like what was an outlier before is now starting to become the norm, and it's just getting pushed further and further out. So what we like to look at is we want people to be here. We want you to be optimal, right? We don't want your numbers low, we don't want them high. We want you to feel good, and the only way you're going to feel good is if all of your values are in an optimal range. So a personal story about this, like probably 2 years prior to the pandemic happening, I was starting to feel not really good. I was starting to feel really anxious, starting to have a lot of ADHD symptoms, like couldn't focus on things, couldn't start tasks, it was really a bit of a struggle, but like a lot of women do, we just kind of push it off to the side and I just have a lot on my plate, and we just chalk it up to our lives, and we're just busy in our lives. Well, when the pandemic hit and things just got really bad. And again, what did I do? I just said, oh, it's a pandemic. That's why everything's terrible in my life. I feel awful because it's pandemic. So as things started opening up, toward the end of the pandemic and people started going back to their doctors, I was like, I don't know if this is just a pandemic. Like, my anxiety started to go so bad. Like, my leg would like shake like this, and my husband would have to be like, stop. He's like, what is going on with you? I'm like, I don't know. My ADHD had gotten so bad I couldn't get up off the couch to like go get a glass of water. It took too much thought process. It was just too much. Like, my brain was like, nope. So I was like, I really need to go in, and something's going on. Let me figure out what's going on. So called my doctor, got my yearly physical done, had to beg her to do, like, this was as I was starting this company, and so I was really getting a lot of information. And so I like begged her, like, can you please just look at X, Y, and Z? Can you look at my hormones? Like, there's something going on. And like, I really had to fight with her to even run those labs. So she did, and I waited and got my lab results back, and never heard anything from her. So I was like, again, like, well, I wonder if everything's okay. But then I was like, let me go check my labs. So I went and looked at all my labs. All of my hormones were here, right here. So were they in the low category? Not necessarily, but they were all on the low end. So if all of your values are low, how do you think you're going to feel? You're going to feel terrible. And I felt terrible. So I actually, and there was some other abnormal stuff in my blood work too that she just didn't even mention, like my protein ratios were off, like my albumin ratios were off, which was an indicator that I wasn't absorbing the nutrients in my gut, that I needed to be. So I probably should have been taking some digestive enzymes and things like that. So I actually took my lab results to my medical director, who creates all my roadmaps for me, and I said, Randy, what's going on with this? Like, I clearly know something's wrong. My doctor is saying there's nothing wrong. What would you do? And so he, looked at it, and he's like, well, let's optimize X, Y, and Z. So he put me on some progesterone, some semi-keto DHEA. And within 2 weeks, all of my symptoms were gone. My anxiety was gone, my ADHD was gone. It was like I came out of this fog that I had been in for 4 solid years, and I didn't even know that I could feel like that anymore. I had forgotten what it actually felt like to be able to form a coherent sentence. As somebody that works in brain health, like, it was really crazy, and it was really challenging time. And so that's why I'm a huge advocate of know your levels. And it doesn't even have to be hormones. It can be anything, any blood work that gets done that's on the lower end, vitamin levels, your blood count, anything like that. Like, you don't want it to be, you don't want all of your, white blood cells to be on the low end of normal, right? We want everything to be really optimized so that we can feel really good, because when things aren't, that's when we start not to feel well. And we know, right? We know our bodies. We've been with our bodies for 40, 50, 60 years. We know when something is wrong. And all too often, when women go to the doctor, and I hear this a lot, especially with older women, is that their doctors just brush it off as anxiety. And I've had a lot of like women in like their 70s like come to me and say, yeah, I'm starting to have some memory issues. I went to my doctor and I talked to him about it, and he said that I'm just stressed out and I just have some anxiety, and he put me on an anxiety medication. That's what happens. They get put on all these medications that we don't probably need, because there's probably something else, going on in our life. Yes, there's been a lot of stress going on, but I guarantee you we're not just all, walking around with nothing but anxiety. Like, there's things that happen in our body, things that get depleted in our body. And like, those lab values are so incredibly important, because they really are a good like roadmap and guide to your body and what's going on. And don't, so many people I think are afraid to confront their doctor or talk to their doctor or say, no, look at this. Why didn't you talk to me about this? And don't be afraid of that. Doctors are not God. They're not the be all end all, and they're not infallible. And it is so hard for doctors right now to keep up with all of the latest research. I mean, you look at doctors, they're trying to see people in 10 to 15 minute visits. Like, there's jam-packed all day long. They get home, they're exhausted. They're not like, hey, let's look up what's the latest research on hormones, right? It's not happening. So it's really difficult for doctors to keep up with a lot of this stuff. So, and I just had the same thing happen to another person on Friday who got put on my protocol, and almost all of, no, I'm not talking hormones, I'm talking all of his lab markers were here. All of them. This poor guy was feeling horrible. He had actually had an appointment with his PCP yesterday and was talking to him about the labs, and his doctor was like, you're fine, all of your labs are normal, you don't need to do anything. So now he's not going to be taking any of my advice. He's not going to be doing it. And I'm just like, oh, it kills me, because I'm like, this guy could be feeling so good. But again, doctors are like, your labs are fine, they're normal. Like you don't need to do anything, you don't need to supplement with anything. It's like,
Yes, it's, I think a lot of doctors chalk it up to it's age related.
It is.
It's age appropriate.
And so what if it's age related?
Deal with it.
So what if like vitamin D is low because I'm getting old? I can do something about it.
Yeah, exactly.
Like so much of this stuff is fixable, and that's what kills me. Is it's fixable, it's easily treatable, and it's, it shouldn't have to be this big huge deal, but for some reason it is. And so that's why don't be afraid to talk to your doctors, and if your doctor is not doing what you need them to do, go find another one. And sometimes you have to go through a couple of them to find a really good one. And like that's what happened to me. I finally found a phenomenal physician, actually nurse practitioner in Frederick, and I tell everybody to go to her because she is the only doctor that's ever listened to me. My appointments with her are like 45 minutes to an hour. She's the only doctor that's ever mentioned the word nutrition.
What's her name?
Terry O'Neill. She's phenomenal. And Doug is actually looking at hiring her.
Oh, really?
Yes. There's a physician that works with us. He does house calls to people that can't get out of their house. So if you have anybody that is like housebound and can't get out, you can go to them. Great physician.
What's his name?
His name's Doug Brown.
Oh.
Mason-Dixon Mobile Medicine.
Okay.
Yeah.
That's interesting.
Yeah. So there's a lot of older adults can't get out of their house. It's really difficult for them to get to the doctor. So he goes to them. So that's my spiel on your optimal values and knowing your ranges and just being your own sort of health advocate and not being afraid. So let me grab a little drink of water because getting into this study, oh my God. So the Women's Health Initiative study, this infamous study that happened, back in the 90s that really kind of set the stage for hormone replacement therapy. Prior to this study, hormone replacement therapy was something that was very widely done. It was just when we get into menopause, you get some hormone replacement, you feel good, you move on with your life. So this was a very landmark placebo-controlled trial, and the goal was to evaluate the benefits of menopausal hormone replacement therapy when used for chronic disease prevention. And a lot of the women that they studied were around the 50 to 80 years old range. So, if hormone replacement therapy used to do a lot of good, why aren't people doing it anymore? And that is because of the risks that supposedly came out during this study about breast cancer, blood clots, et cetera. So why was that? So this study was a very long study. It studied thousands and thousands and thousands of women from a very long time period, 1991 to about 2005. It's like 2002 to 2005, kind of depending on who you talk to, because a part of the study was stopped in 2002 due to, what they thought was the evidence of increased risks of breast cancer and blood clots. Since then, this study has been revisited numerous times, and scientists have looked at it, and the conclusion that they've come to is that the conclusions that they came to back then were not what was actually shown in the study, and the way that the study was designed and carried out was not necessarily in the best practices of a study. So the bioidentical hormone treatments that are being prescribed nowadays, in physicians' offices are vastly different from what was used in this study. What was used in this study is called Premarin, and it stands for pregnant mare urine. So this was estrogen that was taken from pregnant horses, conjugated equine estrogens, extracted from pregnant horse urine. So not only were the conclusions to the study flawed, but the media, which the media is never misrepresented anything, right? The media kind of took this and ran with it. So what is Premarin? It is not a bioidentical hormone, right? We are not horses, last time I checked. And it is not the type of estrogen that the human body produces. We only produce 3 types of estrogen, right? Estradiol, estrone, and estriol. The Premarin had a combination of 21 different types of estrogen, including 18 types that are not made by human, right? So we're taking in this horse estrogen that has all of these different properties in it that aren't even made by our own human body. It's kind of like if you think of like sugar and like stevia, right? And if people do those two have the same acting mechanism on the body if you eat sugar versus eating stevia? No, they're not, right? Stevia is not going to raise your blood sugar. It's not going to contribute to diabetes. It's not, going to do any of this stuff. And that's kind of like comparing, bioidentical estrogen and Premarin. They act completely differently on the human body. And also compares oral versus topical estrogens, right? So when you take which is what this study was, it was oral Premarin. So when you take an oral hormone, what it does is you take it through your mouth and it goes through your liver. And when things get digested through your liver, it can have an increased inflammatory response, and you can get an increased risk of blood clots. So that's why some of these oral hormone replacement therapies are used with caution, because that just going through the aspect of going through the liver can increase your risk of blood clots. So we usually put people on topical hormone replacement therapies because there's a lot of studies, and most of the studies nowadays out are about topical replacements. But the issue with that is insurances don't like to pay for the topical ones because they're a lot more expensive. So you can get oral estrogen for dirt cheap. Like it's really, really inexpensive. But the topical creams are gonna, probably cost you, probably $100, $150 like for 3 months supply. So it's a lot more expensive. They don't cover them, so you're also having to pay out of pocket. So what happens in menopause is when we get this huge drop in estrogen, that is usually a big trigger for brain fog. If you've gone through, menopause, which is like the number one complaint I hear of women who've gotten on like my program and have gone through menopause, is the brain fog. And there's a lot of studies that are showing if addressed early on, we can prevent cognitive decline in women up to about 34%. Right, and I actually believe this to be a lot higher, and I also believe that hormone replacement later in life has a very profound effect. There's just not studies on it. Why? Because nobody's going to pay to study hormone replacements for a 70-year-old woman. They just don't care, right? Like they just don't care enough to want to fund these studies. So it's not that it doesn't work, it's that there's just not a lot of studies out there for later in life hormone replacement therapy. But from a clinical standpoint, and from what I have seen and from what my medical director has seen with that, it has a profound effect on cognition. For people that have mid to late stage Alzheimer's, it can have a huge effect on mood. So a lot of these patients that have a lot of these issues when you get into mid and late stage Alzheimer's, depression, anxiety, a lot of aggression can happen. And what happens to them is they all get snowed under by antipsychotics. They're like, well, this person's acting aggressive, they're resistant to, care, so let's just put them on some antipsychotics. And what does it do? It calms them down, but they're just a zombie. Right. So a lot of times, if you can, again, do a deep dive, let's do some blood work on them, let's look at their hormones, let's look at their vitamins, what's low, and if we can supplement for that, it makes a tremendous difference. Does it cure their Alzheimer's? No. But does it make their quality of life significantly better? Absolutely. Does it help their caregivers not have to work as hard? Does it make somebody go from a 2-person dependent assist to somebody that can stand up with just a little bit of assistance? Yeah, so it has a huge, huge profound effect on their quality of life. But doctors look at you like you're a crazy person when you say, let's give this 80-year-old woman some estrogen. They think you're bananas. But it really, from what we've seen and the people that have gotten on our protocol, it really helps. Yeah.
What you said if addressed early, is that like perimenopause?
Yeah, perimenopause, right as you're going into menopause. Okay. That's where a lot of the studies have been conducted, is right at that threshold. Okay. And we see this a lot. Like Randy was telling me about, a lady who came into his practice and, was she had started her hormone replacements really early on in like her early perimenopause, and then she went off them because her doctor told her to. He's like, your symptoms are gone, you don't need these anymore. So she went off them, and Randy asked me, he's like, well, did you like going off them? Like, how are you feeling now? She was like, no, I feel terrible. She's like, I really want to be back on them. She's like, I felt so much better on them. But again, doctors are only looking at it in like reproduction. Oh, your symptoms are gone, you're not reproducing anymore. We really don't need to supplement for these anymore. So it's to a huge, I think, detriment, and to the detriment of the quality of life of a lot of women that doctors aren't even willing to have these discussions, I don't think. And this is
look at it as somebody passion.
No, they just look at it as unnecessary,
Okay.
which is a whole nother soapbox I could get on about how devalued women's health is and how devalued our quality of life is to the medical community. That is just not even worth studying to them. You know, and a lot of, you know, most studies are done on men, and, you know, women just kind of get the trickle down effect of that. And so nothing's really optimized to us. And we just get, you know, the brush off a lot, but yeah, it's very.
What's the blood test that tells you your number? Is it THST?
So TSH is your
TSH.
thyroid. That's your thyroid.
What's the one that tells you if you're
estrogen?
menopause or not? There's like a specific.
To let you know if you're already
yeah,
going
like
through
it tells you what
menopause.
stage you're in.
I'm not. We don't do that test, so I'm not 100% sure.
Okay.
But I think that's like that test is also variable depending on, you know, where in your cycle you are.
Right.
And that's
Yeah.
another thing. That's a great point,
that's the
Terry.
number.
When you're looking at, if you get your hormones tested, and take note if you are still cycling, right? Take note of your cycle when you got that test done, because if you tested right before your period, if you tested during your period, after, when you're ovulating, it makes a difference with your levels, right? So, you know, most blood work is going to have a range of, if you're in the follicular stimulating phase, if you're in the luteinizing phase, like depending on what phase of it that your cycle you are in, is going to change your hormone value, because they're going to rise and fall through different parts of your cycle. So you can't just look at it as like, oh, my estrogen's really low. Well, you were in the part of your cycle where estrogen is like naturally low, or this is really high, and it's like, well, yeah, because it spikes in the beginning, and, you know, so it's really important to know, you know, at what part. But after you're through menopause, it's a little bit different. Things have kind of leveled out. Yeah, it's a little more challenging. So the North American Menopause Society is a really phenomenal resource for just everything related to menopause and hormonal health. They really set the gold standard and the benchmarks for treatments that physicians are following in the US in regards to hormone replacement therapy. And they are the ones that produce these guidelines. And so as of 2017, their guidelines show not just for brain health, but what hormone replacement therapy can be good for is improving vasomotor symptoms, which are your hot flashes, decreasing insomnia, improving bone density, treatment, prevention and reversal of it, sarcopenia, which is that age-related muscle loss that we get. So hormones really help stave off against that. You know, improved sexual function and genitourinary symptoms, hair and skin elasticity, our connective tissues improve, decreased vestibular issues, so dizziness, vertigo, posture, and just quality of life. So the National Menopause Society has really come out in favor of hormone replacement therapy. They have done a huge review of the Women's Health Initiative study, and I'll get to that in a minute, but you know, they also noted that you have decreased joint pain. You have a lot of hormonal receptors in your joints, estradiol receptors, and so if you're, you know, in your joints, your muscles, your connective tissue, so if your hormones are low, you're going to have increased joint pain. Trials showed improvement in mood, improvement in cognition if started early, and prevention and improvement in Alzheimer's symptoms if initiated early. So, yes.
It says shows improvement in cognition if started early. So like, let's say you're through menopause.
Yes.
Will it improve the brain? See, I can't
From
even
what I've
think.
seen, yes.
iPhone.
Yes, so like I said, all of the studies are really on that early, that's where a lot of the studies are. But anecdotally, from what I have personally witnessed and seen, yes.
And I would think
Yeah.
so.
Yeah,
You know,
it absolutely does. Yeah, it very much
Yeah,
does.
Susan, actually, a friend of mine just started her HR.
Oh, did she?
Yeah, and she's noticed a huge, really huge.
Yeah,
Okay.
it's very profound.
Wow.
Very profound difference. So they really recommend hormone replacement therapy after an appropriate evaluation and, you know, counseling with your physician and making sure that your physician is talking to you and getting your informed consent, that they are weighing the risks and the pros and cons, the risks, you know, of your personal history, right? Because again, everybody's different. You know, people have had different things that happen in their health history that might make it so hormone therapy replacement is not a good option for you. So it's really important to really trust your physician to be able to have these open conversations with them, and to make sure that they're really able to inform you of your personal risks and benefits, for the hormone replacement therapy. They don't recommend routine discontinuation, so this is where like somebody's already started hormone replacement therapy, and like I said, you just discontinue it because your symptoms are gone. They're not in support of that, and they are more in support of the sort of topical transdermal estrogen because it can be a lot safer in older adults as we get older due to that sort of vascular risk of increasing the blood clots through the oral routes through our liver. So, if we kind of dissect the study a little bit, where did these results come from? And, where did it, start to happen that this breakdown came from, that hormone replacement therapy is bad? So if you really look at the study and you pick it apart and you look at the actual risks that were involved, the breast cancer rate in the placebo group, the people that did not get any hormone replacement therapy, there were about 30 breast cancers for every 10,000 women. So that was about a 0.30% risk of breast cancer. Really, really low in the placebo group, right? The cancer rate in the hormone replacement group was 38 cancers for every 10,000, so a 0.38% risk, right? Very, very low risk. Was it an increase? Yes, it was. But the media came out and said there's a 26% increased risk in breast cancer if you do hormone replacement therapy. So people were like, no, thank you, I'm good. I don't want this. Same thing with the blood clot risk, right? The placebo group had a 0.8 blood clots for every about 1,000 women, which is about a 0.08% risk. The people that took the hormone replacements had a 1.9. So if you look at that, right, it is still 1.9% or 0.19% risk of a blood clot is incredibly low. Super, super, super low. However, if you look at those numbers, 0.08 to 1.9 or 0.19 is a 100% increase, is what the media said. There's a 100% increase in risk in blood clots, right? So that's why it's so important when you're looking at studies to really dissect them and to kind of like, it's such a good skill to learn how to have, to like read studies and be able to take out the information and look for yourself. What is the study really saying? How was it conducted? Was it conducted in a good manner that it's going to really give us good, accurate information? And what is the media actually telling us about this study? So, because of this study came out, a lot of women felt bullied by their doctors to kind of, they were on hormone replacement, stopped it, and to their detriment. So NAMS went on to make this statement. This is in their menopause guide about this study. They said that the way that the study was represented really only tells about half the story, and if you double the probability of a rare event, it is still a rare event. And they said that buying 2 lottery tickets instead of 1 increases your relative chance of winning by 100%, but the absolute chance of winning remains very remote. So that's what they're saying was kind of happening with this study. So because of the study, hormone replacement therapy got a super bad rap, got a super bad name, and the older client, older people that were already on this, stopped taking it. People that went through menopause stopped taking it, and so we've kind of been on this like downward slide ever since. This is a really great study that was done by Whitney Wharton. She actually took a lot of studies and combined them and did a summary of these clinical trials that have happened. So a lot of people will do this with different clinical trials that are on one thing. They'll do kind of like a huge, large summary of all of them. So this is a whole lot of different studies that were done. And on the right side is the hormone replacement therapy and benefits. And over here, 17 out of the 23 trials showed that people had cognitive benefits on hormone replacement therapy. None of the trials showed worsening cognition. So none of these trials that were looking at estrogen replaced hormone replacement therapy. There was a difference when people had hormone replacement therapy with estrone. So remember I talked about the 3 hormones, estradiol, estriol, and estrone. We never want to do hormone replacement with just estrone. You really only want to replace with estradiol and sometimes estriol. So it's really important, like when you're doing hormone replacement therapy, to have somebody that really understands the how, the why, the when of hormone replacement therapy. This is an issue because Premarin, the hormone that was in the study is estrone. It was, it isn't estrone. When it was taken, it was converted by the liver and turned into estrone. So I can get really deep into the science of like hormone receptors and why estrone is an issue, but that will take all day. But basically, you don't want estrone to be your primary estrogen because it doesn't act on the receptors in your brain the same way that estradiol does. So you lose a lot of the brain nourishing benefits of hormone replacement therapy because it's just not getting it. Another issue with estrone is that it causes platelet aggregation, which is just another fancy term for blood clots. So it causes your blood to clot, right? So if you're taking something that is estrone, that is, it's going through your liver, which is going to cause increased blood clots. It also promotes platelet aggregation, which is going to cause increased blood clots. You're going to get increased blood clots. So that's why there was a little bit of an increased risk of blood clots with the Premarin. Also, this is why I talk about how this study wasn't really super well done. Most of the women that were in this study already had issues to begin with. They already had vascular damage. They already had plaque. They already had some degree of inflammation. So that alone increased their risk. So again, super important to kind of dissect these studies. And there's, if you want to look this up, there's so much new information about people that have gone back and really looked at this study. So it really shouldn't be sort of the be all end all in hormone replacement because there's so much more that's been looked at now since then. So, just in kind of summary about some of the stuff we've talked about, estrogen in the brain has unequivocally positive results for over 40 plus years of research, especially in a lot of the brain areas that are affected by Alzheimer's disease. So these are kind of the main brain areas, and the estrogen has really been shown to have a very positive effect on these. Most of the studies have been done with the transdermal topical estrogen. So that's really why we like that a lot. It's the safest version, it's the safest form, it's the most easily absorbed form. Again, you're not having to go through your stomach and your liver to get all of this stuff processed. So estradiol is also associated with the maintenance of your neurons, so your neuronal bodies, your axon, your microglia, your astrocytes, those signaling. So when we start to as we get older, we just start to feel like those synapses are not firing as quickly. It's because they're not. So that's why that estradiol is so important. Estrogen really enhances neuroplasticity. So our brains are amazing because they are so neuroplastic, right? They have the ability to regenerate and heal themselves. It's being able to bounce back from an injury, or to make those new connections as we age. Our brains are phenomenal on this if we can give it the right environment to allow that to happen. They really increase ATP production. Adenosine triphosphate is like the main energy producer in our body. So it's kind of like the gas that gets put into the tank. So we have no gas in the tank, our car can't run, we have low ATP production, we feel fatigued and tired and sluggish. So estrogen really helps ramp that up. And it really affects our cognitive tasks where we're able to do things with greater complexity, increased demand on the brain. In regards to Alzheimer's, estrogen or estradiol, E2 is estradiol, has really been shown to reduce amyloid beta plaques in the brain. It helps with the amyloid beta clearance from our cerebral spinal fluid. So in our brain, just like we have our lymphatic system in our body, we have what's called the glymphatic system in our brain. And it's the same mechanism that happens throughout our body where our lymphatic fluid gets flushed in and out. The same thing happens in our brain, right? There's some really cool videos of it, like on YouTube. You can kind of see the cerebral spinal fluid going in and out. This largely happens at night, or this is when it's the most active, is at night when we're sleeping. So that's why good quality sleep is so important to brain health. But a big mechanism of what happens with our lymphatic system is this lymph fluid is flushing out the amyloid beta plaques in our brain. Amyloid beta plaques are a useful feature of our brain. Like, we don't just have them in our body for no reason, right? They are actually thought to be a protective mechanism in our brain. So when we have all these different insults to our brain, inflammation and diseases and stuff like that, these are kind of like the first line of defense. But what happens is if we just keep adding more and more soldiers and we're never taking away any of the soldiers, and some of the soldiers die, and it just keeps piling up and we're not able to get rid of it, that's kind of what's happening in our brain with the amyloid beta plaques and protein. So the cerebral spinal fluid helps to flush that out, and the estradiol really helps in that process. And then estradiol also helps to reduce the inflammatory aspect of those amyloid plaques, because again, they are an inflammatory response, they're a protective response. And inflammation in our body is good to a degree, right? We sprain our ankle, we get a little bit of inflammation, kind of helps to heal. It's when that inflammation becomes chronic and it doesn't go away that we start to have a lot of the issues, and that's what happens. It's the same mechanism that kind of happens in our brain. It's also, like I mentioned earlier on, why a lot of these drugs that are trying to fight Alzheimer's are never going to be able to, we have all these drugs that we have right now, their main purpose is to clear the brain out of amyloid plaques. And we find that when we do that, people actually decline and get worse, because we do need some of them. We just don't need that many, So it's really important to kind of think of your body and your brain like a house. So if I mentioned that hormones are just one hole, right? But we have all of these other holes in our body, to kind of patch up and to look at if we're really trying to improve our brain health. So the best thing that you can do is be proactive and not reactive, right? So prevention is key. The more that you can know about your body, the more that you can know about your brain health, the sooner you can intervene as soon as something starts to go wrong, or even before it starts to go wrong. The earliest interventions have the most success. We can really, reverse cognitive decline in the early stages, but once somebody gets into the mid and late stages of Alzheimer's and their brain starts to atrophy, there's really no coming back from that, unfortunately. So it's why, early intervention is so important. Cognitive testing is really a fantastic way to figure out what's going on in your brain right now. It's like a little snapshot of your brain, here's what's happening. And if you do that year after year, like a mammogram or a colonoscopy, you can compare your results and you can start to notice, hey, here's what my memory score was last year and here's what it is this year. This isn't something's going on, let's figure this out, right? So you can catch it early instead of waiting 5 or 10 years until you really start to have significant memory problems. And then knowing your risk profiles, right? Getting your lab work done, figuring out what your risks are, for, just what's happening in your body, what can you optimize, what can you improve on. This is just information about the cognitive testing and what we do. There's a couple of different tests that we take people through. It can be done virtually or in person. So if you have somebody that you're concerned about, that you just kind of want to get a good, check of their brain. So it's a really easy way to do that. And I really like to show this slide because it shows, these are all of the things that we look at when it comes to brain health. Yeah, so hormones, little tiny piece of it, crucial, very important, but tiny piece of brain health. But there's so much that goes on with our brains and that happens to our body that affects our brains. And the late Desmond Tutu said, we need to stop pulling people out of the river. We have to go upstream and find why they're falling in the first place. So that's what we try to do, is we get to the root cause of what is happening in somebody's body that's causing their cognitive decline. And when we're able to do that, we can really start to see a lot of massive gains. So just some food for thought. Hormone replacement therapy is not for everybody, right? It's very individualized, it's very personalized, and it's really important to have a doctor who really understands it and who understands how hormones affect not just your reproductive system, but your brain as well. It's important to make decisions based on your personal health history. There's a lot of additional aspects to look at in regards to brain health, even before starting hormone replacement therapy, right? So if you're starting to have brain issues or brain fog, or somebody that is, like as you saw that previous slide, there's a lot of stuff that we can look at before we even need to go down that road. But if you are intervening and you are doing all this stuff and you're still not quite seeing the result that you want, we can really start to look at. Some people like to start their hormones right away. Some people never do it. Some people like to wait. So it's just really based on somebody's personal preference and how they're feeling. But there's so much else that you can look at in regards. You deserve a share in your decision-making process, right? It shouldn't just be your doctor and what your doctor says. You deserve to be informed, and you deserve to know what's going on in your body, and your doctor owes it to you to be able to have conversations with you without dismissing you and making you feel like you're ridiculous for even asking. So don't be afraid to talk to your doctors. And like I said, know your levels, know your values, read your lab results, look them up. And if anything seems unusual or out of whack, or something's highlighted in red and your doctor didn't even bother to call you about it, call them and talk to them. That's very important. I'd love to open it up for any questions, if you guys have any.
Yes. I have a bunch.
Yes.
First one is, do you have any naturopathic doctors on your staff that might consider, before prescribing hormone therapy, trying to get your hormones in balance naturally with supplements and things
Mhm.
that the hormones might not be getting, I mean,
Yeah.
glands might not be getting.
Yes, yeah, that's what we do too. Yeah, we have ways to help people there's a lot of ways to help boost your hormones naturally without going straight to hormone replacement
So you
therapy.
do offer that.
Yeah, absolutely.
And what kind of insurance, do you take insurance?
We don't take insurance, no.
Oh.
Insurance doesn't like to pay for prevention or exploratory measures, so
Right.
someday maybe they will and realize how much money it would save
Yeah,
them.
really.
We don't take insurance. We do like payment plans and stuff like that, and we have a lot of different offers for people, and we can help find, if you're interested in stuff, something that will work for you in your budget.
Do you know anything other than your nurse practitioner? Do you know anything about the doctors who are in tune to hormone health other than just reproductive? Like I go to Dr. Slipper, I shouldn't say so, and I love him, and I feel like he's pretty forward thinking, but I don't know if you're allowed to talk about specific which doctors.
Yeah, I mean, there's not a lot. It's really hard
Yeah.
right now. You're gonna find it mostly with you want to look up functional medicine physicians. That's because functional medicine practitioners are the ones that are looking at your whole body, because
Yeah.
our body does not work in isolation, right? Nothing works on its own. You have to look at how everything is affecting everything else. So that's kind of who you want to look at.
Yeah.
I really love Terry O'Neill. She's phenomenal. She's not she is a type of functional medicine doctor, but she's just really amazing. But there are there's
Does
a
she
really
take
good one.
insurance?
She does, yes.
Okay. And
Yep.
she's here in Frederick.
She is, yep.
Did you say she was a nurse practitioner?
She's a nurse practitioner, yep.
Um,
Yeah, she's really fantastic.
Is there any of this that's hereditary, out of control,
Great question. So genetics does play a tiny little factor. And that's one thing that we look at when people get on our protocols. We look at their genetics. So if somebody has the Alzheimer's gene, they're ApoE44 positive, that does not mean that they're going to get Alzheimer's by any stretch of the imagination. You saw all these things that affect brain health. All those things affect Alzheimer's, right? So the genetics are a little tiny piece of that. Doesn't mean you're going to get Alzheimer's. You will if you don't correct a lot of it, right? So you want to, again, find out your risk factors, find out what's going on in your body that is leading you down that path so you can course correct. But knowing that somebody has the Alzheimer's gene or is, ApoE44 positive just lets us know that your body likes to hold on to inflammation. Okay, so
What's the name of the?
it's the Alzheimer's gene, APOE,
Oh,
44.
oh.
Yeah, is somebody that has both copies. So the
Okay.
ApoE4 genome is the Alzheimer's gene, and you have two of these different genes. And so you can either be ApoE44, 34, 33, 23. So there's different levels of it. But what it does is,
Keep up with that looking up.
a lot of people don't want to know. They don't want to know their genetics. But for us, it's really a great tool though, because we can say, okay, you're ApoE44. Not a big deal. It just means your body likes to hold on to inflammation. So you want to be careful with diabetes and the foods that you eat and making sure that we can do everything we can to tamp that down. Somebody that's ApoE33 has no copies of the Alzheimer's gene, but we know that genetic type likes to hold on to toxicity. So your body's going to hold on to
Where do you
heavy
testify?
metals.
Just your normal doctor?
Yeah, so insurance doesn't like to pay for genetic testing, so you usually have to pay out of pocket.
Okay.
We do all our testing through LabCorp. We have a contract with them, so people can get discounted pricing through them. But it's such a good tool, like for us, to know, like, okay, we really are going to need to focus on helping to detox your body because you might be holding on to different pathogens, mycotoxins, molds, different heavy metals. Herbicides, pesticides, these things might just linger around in your body longer because your natural detox pathway just might be a little more compromised than somebody that doesn't have that genotype.
Yeah, like something environmental too. Like
Yeah.
You're looking at.
Environmental factors are really starting to be very widely researched, especially when it comes to Parkinson's disease. They're really noticing that toxicity, from the air, like cadmium and air pollution, people that have been significantly exposed to like Roundup, herbicides, people that grew up on a farm. So many of the vets that were in Vietnam and exposed to Agent Orange, a huge chunk of them have Parkinson's
That's what
disease.
my dad was.
Yeah.
He's a disabled vet from Vietnam.
Yeah, so they're really showing that that toxicity is really playing a huge role in Parkinson's disease. So, yes.
So can you describe what your protocol does, like what you do?
Oh, sure. Yeah, so we put people on a quarter by quarter protocol. It's called the enhanced protocol. And we're, again, looking at your whole body system to find out what's going on. So we do a full panel of labs. It's like 40 different labs. It's like 17 bottles of blood. I'm so sorry. It's so much blood.
17?
It's all the blood. It's all the blood in your body. But because we're looking at so many different things. Like we're looking at so much more than your like regular doctor is going to look at when you go to your physical. And we're looking at it in a different way than your doctor's going to look at it. Okay, so we're not just like, oh, your vitamin C is low. Okay, great. No, we're looking at like, okay, so you have the gene that makes it so you don't methylate B vitamins, which is now causing your homocysteine to rise, which is causing the inflammation in your brain to rise. So, like that's how we're looking at your labs. We're really trying to connect the dots and put all the pieces together. We're not just looking at your labs in isolation. We get a health history. It's really like a life history because a lot of things that happen to people when they were younger have a cumulative effect on their brain as they get older. It makes it so their body is less able to detox and to clear out things and to heal from different insults that have happened throughout their life. And then we do the cognitive testing. So we get a really good snapshot of what's happening in your brain right now. Then we take all of that information and my medical director combines it into what's called a roadmap report. And this is like an 80-page document. My last one was 80 pages.
Wow.
That's really like a roadmap to your body. And it lists all the information in about here's what's going on in your body right now, here's the interventions that you can start taking to start improving it, and here's why. So you will have all of the information about every single intervention that we're doing, you will have the research behind it, and you'll be able to be like really well informed about what's going on in your body. And then depending on what package you get, some people really need, coaching, so we help people, coach them throughout the quarter. We're looking at improving nutrition, exercise, stress, sleep habits. We look at genetics, toxicity, hormones, gut health. So you name it, we're kind of helping you with all of that. And a lot of people kind of need some guidance through that. Otherwise, it's really overwhelming. If you're local,
I was just gonna say my anxiety.
yeah. So that's why we coach people through it. Yeah. So we meet with them. And then if you're local, you also have access to our brain therapy studio, which has a lot of really awesome brain therapy devices in it that just really work on helping put the body in an optimal state of healing. They help to reduce inflammation, improve circulation. So we have like pulse electromagnetic frequency therapy. We have audiovisual entrainment, red light and infrared sauna, red light therapy. So there's a lot of really cool therapies that just really help kind of like boost your body up and help it heal. And then we take you through that, and then at the end of the quarter, we retest any suboptimal lab markers. So anything that we were trying to supplement for that might have been low, we're going to retest it to make sure we're on track now where we want to be, and then we redo the cognitive testing.
Every quarter.
Yeah, if you decide like, oh yeah, I'm not quite where I want to be, I'm going to continue on, then we'll keep redoing it. Or if you're like, yeah, I feel like I've got a really good handle on this, I can kind of take it from here.